Hi, Kirtana. Tell me about yourself.
Good morning, ma'am. I'm Kirtana from Chennai. Completed MSc Food Science and Nutrition in Gandhigam Rural Institute, Dindigul.
What is the king of disease?
Gout is the king of the disease.
What are connective tissue disease conditions?
Some connective tissue conditions are SLE, systemic lupus erythematosus, scleroderma, rheumatoid arthritis, polymyositis.
What is antepartum, postpartum, and puerperium period?
Antepartum is before delivery, postpartum after delivery, puerperium period of 6th week following childbirth.
What is modifier and its types?
Modifiers is the 2-digit code. Modifiers are extension added at the end of the CPT code. It produced more information about procedure and used to communicate, might increase or decrease the amount of reimbursement. Types of modifier: CPT modifier, facility modifier, tech and fix modifier.
What is encephalitis?
Encephalitis means inflammation of brain.
What is PIN and TIN?
PIN, personal identification number. TIN, taxpayer identification number.
What are the categories of diabetes mellitus?
Diabetes mellitus are divided into two types, primary and secondary. Primary diabetes divided into two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes is the juvenile diabetes also. Type 1 diabetes is the insulin-dependent diabetes mellitus. It occurs in below 30 years. Type 2 diabetes mellitus is the non-insulin dependent diabetes mellitus. It occurs in above 30 years.
What are psychoactive substances?
Alcohol, nicotine, caffeine, opioids, hallucinogen, cannabis.
What are the ICD-10-CM guidelines for sepsis?
Sepsis. The bacteria produce some toxic substances in blood is the sepsis. Sepsis guideline. Sepsis code is the primary code. Severe sepsis code is the secondary code. Additional codes are assigned for some organ failure or dysfunction. Severe septic shock code used for sepsis with septic shock.
What are the ICD-10-CM guidelines for fracture?
Fracture is the breakage of bone or cartilage. Guidelines for fracture is first note the anatomical site, then check the lateralitis, whether the bones are displaced or non-displaced. Check the malunion or non-union. Sequencing order is the must. SL, FL, SCA. F means fracture, L means laceration, S means sprain, C means contusion, and A means abrasion. Assigned encounter code if applicable.
Can you explain the difference between the guidelines of adverse effect and poisoning?
Adverse effect means produced drug, prescribed drug produce some toxic, some side effects. Poisoning means overdose of drug intentionally or unintentionally. Wrong prescription, drug mixed with alcohol, prescribed which is non-prescribed.
What are the ICD-10-CM guidelines for external causes?
Guidelines: reason for injury, place of occurrence, activity code and status code. Action is the main term and always use 7-digit codes.
What are the ICD-10-CM guidelines for pregnancy?
Pregnancy guideline: every condition should be coded in normal delivery. C-section code is the primary code. Z series code, gestation week codes are assigned at the last code. Complication of pregnancy is the secondary code. Complication of pregnancy secondary code. Seventh character is need applicable. Which number of fetus is arrived? Note the postpartum and antepartum period. Note puerperium period. Delivery should be assigned in every maternal records.
What are the ICD-10-CM guidelines for neoplasm?
Neoplasm. Some guidelines is neoplasm means blood, any abnormal cell or growth, any abnormal growth of cell or tissue in blood is neoplasm. Types is benign, should not spread to nearby tissue. Malignant should spread to nearby tissue. Carcinoma in situ, partially developed malignant. Guidelines. Sequencing order is the must. Then current active treatment code is the primary code, followed by spreading code is secondary. Assigned history if applicable. Assigned code for encounter code is needed when if applicable.
What is metastasis?
Metastasis is the process by which is cancer cell break away from their original tumor and it's spread to other part of body.
Can you explain seventh character of an ICD-10-CM code?
Seventh character is the extension. It's used to status of issue or encounter of issue. Encounter is divided into three types: initial encounter, subsequent encounter, and sequela. Initial encounter is the first time visit to the hospital sector. It's also default encounter. Subsequent encounter is second time visit to the hospital sector for same disease and same complication. Third time visit is the sequela, complication after injury.
What is thrombus?
Thrombus, a clot formed from the blood components. It is found in the cardiovascular system.
What are the layers of skin?
Skin has the three layers: epidermis, dermis, and subcutaneous tissue. Epidermis is the outer layer, dermis is the middle layer, subcutaneous tissue is the innermost layer of the skin.
What is the medical term of kneecap?
Patella.
What is the total number of bones in an adult, children, and fetus?
Total bone in adult is 206, children is 213, fetus is 306.
Which is called Adam's apple?
Thyroid cartilage is the Adam's apple.
What is hysterectomy?
Surgical puncture to remove the uterus.
What is atherosclerosis?
Patchy lipid deposit large and medium inside large and medium sized arteries.
What is epiglottis and its function?
Epiglottis is the elastic plate of cartilage at the posterior part of the tongue. And function is when you open your mouth, epiglottis is an open mouth. Epiglottis opens. It allows the air into the larynx. When you swallow the mouth, epiglottis closes to prevent food entering into the lungs.
What is GERD? G-E-R-D, GERD.
GERD is gastroesophageal reflux disease.
What is the second cranial nerve?
Optic nerve is the second cranial nerve.
Can you explain in detail Functions of heart.
Heart functions. Superior vena cava and inferior vena cava carries deoxygenated blood from upper and lower portion of the body. Then superior vena cava and inferior vena cava carries deoxygenated blood into right atrium into right ventricle through tricuspid wall. Right ventricle, deoxygenated blood from right ventricle. It passes pulmonary semilunar valve into left and right pulmonary artery. Left and right pulmonary artery, deoxygenated blood passes left and right of lung and alveolar region of lungs. In alveolar region get oxidized by inhalation process. Pulmonary vein carries oxygenated blood from lung into left atrium of heart. Left atrium of heart. In left atrium of oxygenated blood throws into left ventricle by bicuspid wall. From the left ventricle, oxygenated blood into aortic semilunar wall. It passes into aorta. This aorta carries oxygenated blood into three main branches of aorta. Left common carotid artery, brachiophilic trunk, and the third one is left subclavian artery. These arteries carries oxygenated blood into rest of the body and through arterial system. The cycle is repeated.
Okay, Kirtana. Thank you.
Thank you, ma'am.